Greetings and welcome to this presentation on additional anti-infective agents by Nicole Treb, Leah Zwilling, Sarah Tasto, and Sherry Steffes. In this presentation, we will discuss a summary of each category, a drug example for each category, typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. First, we'll take a look at anti-tubercular agents. So tuberculosis is caused by the pathogen tuberculous. It's the world's most detrimental disease. It actually kills more people than any other infectious disease, and it's transmitted from person to person via airborne droplets such as coughing or sneezing. So the anti-tubercular drugs inhibit the tubercle cell wall synthesis and block pyridoxine, which is an intracellular enzyme production. So for prophylactic use, it can be used in patients that have been in contact with someone who has tuberculosis or in an HIV positive client who has a positive Mantoux skin test, but it would be contraindicated in those who have liver disease. And overall, a multi-drug therapy against tuberculosis is going to be the most effective treatment. So for an example, we have isoniazid here. The dosing for isoniazid is going to be an oral or intramuscular for adults at 300 milligrams per day or 5 milligrams per kilogram up to 15 milligrams per kilogram up to 900 milligrams 2 to 3 times weekly. For children, intramuscularly or orally under the weight of 40 kilograms. For latent tuberculosis infections, it'll be 10 to 20 milligrams per kilogram per day up to 300 milligrams per day or 20 to 40 milligrams per kilograms up to 900 milligrams 2 times weekly. If they have an active tuberculosis infection, the dose would be 10 to 15 milligrams per kilogram per day up to 300 milligrams per day or 20 to 40 milligrams per kilogram up to 900 milligrams 2 times weekly. Side effects include psychoses, seizures, visual disturbances, nausea, vomiting, rashes, gynecomastia, blood dyscrasias, peripheral neuropathy, and fever. Adverse effects include drug-induced hepatitis. Special considerations: administer with food if GI upset occurs, but avoid antacids with aluminum within an hour of administration. And if overdose occurs, the treatment would be with pyridoxine or vitamin B as per your institution's protocols. Common nursing interventions include obtaining any susceptibility tests or mycobacterial studies prior to beginning this therapy, and hepatic function should be evaluated and monitored. Next, we'll take a look at some antifungal agents here. So mycoses are infections that are caused by a fungi or fungus and can either be superficial or systemic. So fungal infections that are superficial can be acquired through direct contact with an infected person and typically involve the integumentary system, or systemic type fungal infections are usually transmitted through inhalation into the lungs and can even affect the central nervous system. They can either be opportunistic and common among debilitated or immunocompromised individuals, or non-opportunistic and occur in any population. But these fungal infections are treated with antifungals or antimycotic drugs and are classified into the groups of polyenes, azoles, antimetabolites, echinocandins, and antiprotozoals. So taking a look at an example, we have fluconazole, which can be administered orally or intravenously to adults. For oropharyngeal or esophageal candidiasis, the dose is 200 milligrams initially, then 100 milligrams per day for 2 to 3 weeks with neonatal or child dosing adjustments. For systemic candidiasis, it's 400 milligrams initially, then 200 to 800 milligrams per day for 28 days with neonatal and childhood dosing adjustments, again, depending on age. For cryptococcal meningitis, it's 400 milligrams per day until the favorable clinical response has occurred, then 200 to 800 milligrams daily for 10 to 12 weeks or until the cerebrospinal fluid has cleared. After that, you're going to change to oral therapy as soon as possible. Suppressive therapy would be 200 milligrams once daily, and dosage adjustments would be required for neonates and children. Orally for adults, it can also be used for vaginal candidiasis at 150 milligrams for a single dose, and for recurrence prevention, it would be 150 milligrams daily for 3 days and then weekly for 6 months. The side effects would include headache, dizziness, seizures, abdominal discomfort, diarrhea, nausea, vomiting, exfoliative skin disorders, hypokalemia, hypertriglyceridemia. And for adverse effects, we have hepatotoxicity, Stevens-Johnson syndrome, and anaphylaxis. Special considerations include the geriatric population being at an increased risk for adverse effects. Make sure you do obtain any specimen cultures prior to starting therapy, and then patients who have a renal dysfunction will require a dosing adjustment. Common nursing interventions: make sure to assess the infected area, assessing the patient for rashes, and then from a lab standpoint, make sure to monitor liver function tests, BUN, creatinine. The next category is peptides and metronidazole. So bacitracin and polymyxins are the two groups of peptides that are used as antibiotics. Bacitracin inhibits the synthesis of cell wall, causing the damage to the membrane, whereas the polymyxins are going to produce a bactericidal effect on the cell membrane, also causing death. And metronidazole is going to be used for the treatment of organisms affecting the gastrointestinal tract, and is prescribed to impair the DNA function of these susceptible bacteria. Antiviral agents. So a virus is an organism that's going to be a lot more difficult to destroy than a bacteria. It's going to rely on the host cell to reproduce and survive. So they destroy the healthy cells by generating more cells with the same DNA and RNA as themselves, and only until the virus has replicated can it be detectable. So antivirals are going to work in one of three ways. One, they're going to block entry to the cell. Two, they're going to act inside the cell to block replication. Or three, they're going to stop the virus from exiting the cells and spreading. An example of an antiviral agent would be acyclovir. So acyclovir can be given orally to adults and children for varicella or chickenpox at 20 milligrams per kilogram, not to exceed 800 milligrams per dose, 4 times a day for 5 days within 24 hours of the onset of the rash or the vesicles. For herpes simplex, which can be like your common cold sores or genital herpes, it'd be 200 milligrams every 4 hours while they are awake, or 800 milligrams every 8 hours for 7 to 10 days, not to exceed 80 milligrams per kilogram per day in children. Herpes zoster, also known as shingles, the dosing is 4,000 milligrams per day divided into 5 doses for 5 to 7 days, not to exceed 80 milligrams per kilogram per day, and divided into 5 doses for children. It can also be given intravenously in specific circumstances at a dosing of 5 milligrams per kilogram every 8 hours for 5 to 7 days. Topically, it can be given 5 times a day for 4 days, such as like herpes labialis around the lips. Or it can be used in the buccal mucosa, where you actually take a tablet and put it inside the upper gum, but that needs to be done within 1 hour of the onset of symptoms. Side effects include dizziness, headache, hallucinations, trembling, diarrhea, nausea, vomiting, increased liver enzyme, abdominal pain, anorexia, crystalluria, hematuria, renal pain, acne, hives, rash, unusual sweating, changes in menstrual cycle, pain, phlebitis, local irritation, and joint pain. Adverse effects include seizures, renal failure, and Stevens-Johnson syndrome, which I included a picture of for you to see here in case you haven't seen it in the past. Special considerations. This medication does cross the placenta and it can enter breast milk. If you are giving it in an oral solution, make sure to shake it well before administration. And if you're administering it intravenously, make sure that the patient is going to be maintaining an adequate fluid intake of 2,000 to 3,000 milliliters per day. Nursing interventions include a good, thorough integumentary assessment, assessing for lesions, finding out the frequency, recurrences, and then if they have like herpes and encephalitis, you're going to be monitoring their neurological status. As far as labs go, make sure to monitor BUN, creatinine, and CCR before and during therapy. The next category is anti-malarial agents. So the infected Anopheles mosquitoes are one of the most prevalent protozoan disease carriers of the Plasmodium species. They cause diseases such as malaria. And worldwide, there's roughly 2 million cases reported, and in the United States, it's fairly uncommon. And the treatment is going to vary depending on the organism's life cycle and the parasite. So you're either going to be treating it prophylactically, treating an acute attack, or preventing a relapse. Our example for this category would be chloroquine. Chloroquine will be administered orally for suppression or prophylactics. In adults, it's going to be 300 milligrams once a week, starting 2 weeks prior to entering the endemic areas and for 8 weeks afterwards. And if suppressive therapy is not initiated prior to entering the endemic area, the initial dose should be 300 milligrams, followed by 300 milligrams in 6 hours, and then the usual dosing regimen. Orally in children, it's 5 milligrams per kilogram once weekly, starting 2 weeks prior to entering endemic area and for 8 weeks afterwards, not to exceed 300 milligrams per day. If you're treating an acute attack of malaria, the oral dose for an adult is going to be 600 milligrams initially, 300 milligrams at 6 to 8 hours, and then 24 hours and 48 hours after that initial dose. Side effects include anxiety, agitation, confusion, delirium, depression, extrapyramidal reactions, hallucinations, headaches, insomnia, personality changes, polyneuritis, psychosis, corneal opacities, hearing impairment, retinopathy, tinnitus, visual disturbances, cardiomyopathy, ECG changes, hypotension, abdominal cramps, anorexia, diarrhea, hepatitis, increased liver enzymes, nausea, vomiting, alopecia, dermatoses, photosensitivity, pigmentary changes, pruritus, skin eruptions, urticaria, thrombocytopenia, neuropathy, peripheral neuritis, and weakness. Adverse effects include seizures, Stevens-Johnson syndrome, toxic epidermal necrolysis, agranulocytosis, aplastic anemia, and leukopenia. Special considerations. So adverse reactions can occur in nursing infants and pediatric patients because they're extremely sensitive to the chloroquine effects. And then the geriatric population might be also predisposed to the adverse effects. and you're going to want to watch for a decreased white blood cell and platelet count. Common nursing intervention include assessing deep tendon reflexes, ophthalmologic examinations, skin examinations or the integumentary system, and monitoring the CBCs or complete blood counts. The next category, entelhelminths. Helminths are basically parasites, and they can be worms or something similar to that. They're going to be commonly found in the intestine, but they can also infect the lymphatic system, blood vessels, liver, and they're going to either enter the human or the host through contaminated food, insect bites, or in some cases they can actually just directly penetrate right into the skin. Our example for this category is ivermectin. Ivermectin is going to be dosed either orally or topically. Orally for adults and children it's going to be between 150 micrograms per kilogram as a single dose, and possibly repeated, again depending on what you're treating. It can also be used topically for head lice in adults or children, topically applying the lotion to the dry hair, rubbing it in until the scalp is moist and leaving it on for 10 minutes and then rinsing it off. Or for rosacea, it can be used once a day to the face. Side effects include dizziness, drowsiness, fatigue, vertigo, weakness, conjunctivitis, abdominal pain, anorexia, constipation, diarrhea, nausea, vomiting, and topical burning sensations or dry skin, pruritus, rash, urticaria, and tremor. No side effects were noted by the Davis Drug Guide. Special considerations include noting that this medication can enter the breast milk and to take this medication as a single dose on an empty stomach with water. Nursing interventions are going to depend on what you're treating. If you're treating a systemic infection, you're going to be probably monitoring for repeated stool samples to make sure that that infection is cleared. If you are treating something in the lymphatic system, you're going to be monitoring for tenderness of the axillary, cervical, inguinal, or other lymph nodes. You're going to be watching for edema. If they have a skin type of an infection, you're going to be watching for papular and pustular reactions, and you're also going to be watching for fevers. If they have head lice or rosacea, again, it's going to be very location specific with regards to follow-up on that. The last category is drugs for urinary tract disorders. So the largest number of urinary tract disorders are caused by urinary tract infections, and antiseptics or anti-infective drugs are used to either prevent bacterial growth, but they're not necessarily always used for systemic infections, which kind of limits them to the treatment of urinary tract infections. So anti-infectives and anti-infectives can have bacteriostatic effects in low dosage or bactericidal effects in high dosage. Again, just kind of depending on what you're treating and what your goal is there. There's also drugs that can be used in this category for pain and burning in urination called urinary analgesics, or drugs that stimulate the bladder by initiating contraction of the detrusor urinary muscles, such as urinary stimulants, or antispasmodics that can be used for urinary tract spasms as the result of an infection or an injury. An example of this kind of drug category medication would be bethanechol. And bethanechol is given orally or subcutaneously to adults or children, depending on exactly their age and what circumstances are going to apply. Side effects are going to include headache, malaise, lacrimation, meiosis, bronchospasm, bradycardia, hypotension, abdominal discomfort, diarrhea, nausea, salivation, vomiting, urgency, flushing, sweating, and hypothermia. Adverse effects include heart block, syncope, and cardiac arrest. Special considerations: make sure to take this medication on an empty stomach 1 hour before or 2 hours after meals to prevent nausea and vomiting. And common nursing interventions include monitoring blood pressure, pulse, respirations, intake and output, palpating the abdomen for distension, doing post-void bladder scans, and observing for toxicities such as the sweating, flushing, nausea, salivation, and abdominal cramps. So, as a summary on this presentation on additional anti-infective agents, we summarized each category, gave an example for each category, discussed typical routes of administration, common side effects and adverse effects, special considerations, and common nursing interventions. Thank you for watching this presentation brought to you by Team All the Azepams.